jump in, or?
Yeah, I think so. There's a small enough number that I think we could probably just jump in.
Okay. I don't believe we need a special session. The governor did declare an emergency, and under the national emergency clause of the federal Constitution, so that gives him quite a bit of latitude to rearrange expenditure priorities, to allocate resources, to take steps that would normally require General Assembly approval. So I think in cases like this, at least the textbooks tell us that crises are better managed when there's really a clear chain of authority and there is strong leadership. And I think that very much comes from the executive branch and needs to come from Governor Northam. Whether we're doing enough, I think the governor has taken this very seriously. Certainly, he was very quick to close the public schools. He is balancing the economic issues about the complete close down of restaurants against the need for individuals to actually shelter in place. Right now we're under the requirement that no more than 10 individuals can gather in one place. Restaurants are encouraged to still stay open for carry-out orders. And that's probably okay. I mean, that's a good thing. We're seeing social distancing making a difference. Frankly, the biggest issue we're facing, and it's not just an issue in Virginia, is the real lack of protective clothing and protective gear for our healthcare professionals, and then the supply, the actual ventilators and supplies that you need to care for individuals who have the COVID ID condition. So this is just mind-boggling to many of us. Our hearts go out to our frontline providers who are testing us, who are dealing with people who are showing symptoms of the COVID ID, and yet they don't have the supplies and equipment they need. We were told, I guess on a conference call last week, maybe my colleagues were on that call. I know, Rip, I think you were on the call. Patrick, I don't know if you were. We were told that we're going to be incredibly increasing the supply of the protective gear for our healthcare professionals. And that will enable us to test more individuals and to perhaps get a much stronger handle on the virus.
Mark, I don't know if you can hear me.
Yeah.
Perfect. Just a couple things. One, I agree with everything, of course, Barbara said. I had a chance, maybe it was at that call, I can't remember, Barbara, to ask the state epidemiologist specifically about Arlington, because Barbara is right. Arlington has if not the highest, it might be the second highest number of cases at this point. And my sense of this is me talking, is on a per capita basis. It's because we're about at the same as Fairfax, which of course is much bigger than Arlington. So I asked Dr. Peak, the state epidemiologist, whether that indicated Arlington is a cluster, because that has some ramifications for how the epidemiologists approach things, and certainly could have ramifications for what the governor were to do. And she told me that the answer to that was no, despite the large number, because they had not been able to establish any community spread, that those numbers were a result of community spread. In other words, no connections between the people in Arlington that so far have tested positive. And there could be a million reasons for that, including the fact that Arlingtonians are, they travel a lot, and who knows where they got the infection. But my point simply is, it would seem to suggest that certainly in Arlington's case, and I think this is true statewide, that the sort of social distancing measures that the governor put in place, the president has talked about, and that all of us have been touting in various emails to constituents. I don't want to be paint too rosy a picture. I'm not sure it's working, but it so far at least seems to have stopped a community spread in Arlington, at least as far as the numbers are concerned right now. So, God only knows, and I mean that quite literally. God only knows probably where we'll be, 3-4 weeks from now. But it seems to me, from my perspective, that our community is pulling together quite well. The governor is leading us quite well. We're all frustrated. If you talk to the governor or listen in on his press conferences, which anyone who's listening, by the way, can do, he's as frustrated as anyone with the stockpiling issue, the lack of masks, the lack of other PPE equipment, the lack of tests, of course. But we're all hopeful that we're on the verge of solving those problems.
Mark, if I could just
Sure.
jump in. Your question was, do we need a special session? And I agree with Senator Favola that I don't think that we need that right now. The Fed seem to be moving really at breakneck speed for them to address the issues with small businesses, which we've heard a lot from in Arlington, and from unemployment insurance, trying to make workers whole, to help them with health care, trying to waive co-pays for testing and also for treatment, if that's what's necessary, but also addressing small businesses and workers. And then apropos to what Senator Favola's really good bill about sick leave, I think that should be something that should be at least discussed at the state level. But so that's the question about whether we should have a special session to do that. The other question is, are we doing enough? And I think that's the thing that people are asking over and over, because you see states around us literally shutting down, major states, Illinois, California, New York, Pennsylvania, shutting down, really. Virginia hasn't quite done that yet. My biggest concern is that whether we are taking this pandemic seriously enough. And Arlington, I think if you walk around Arlington, if you go to the grocery stores or you do carry out supporting small businesses, which I support and I hope we all do, I think Arlingtonians are taking it very seriously. And my sense is that Northern Virginia is doing a pretty decent job of doing that. But this is really hard on my family and a lot of families. And so yesterday, my wife and I decided to take our kids out to Fredericksburg area to drive around. In fact, we went around to see, my daughter goes to Kenmore Middle School, and we wanted to see the Kenmore that it was named after. And so we drove there just to drive around. We never got out of a car. We practiced safe distancing. But my observation of people driving through Fredericksburg are not taking this seriously. And I don't know if you saw Blue Virginia, Lowell Feld's blog that he puts up. He was showing Amanda Chase had some comments about pleading with her supporters to take this seriously. And the comments on the Facebook page were anything but in taking it seriously. So that's my concern, is that there's a large section of the state that aren't taking this seriously enough. And the question is that the governor's directive, is that enough? Are we taking it seriously enough throughout the whole Commonwealth? Because right now, I think Northern Virginia is doing a fairly good job of trying to contain the spread of this pandemic, this virus. But are we going to see down the road where we're not doing enough and the rest of the state is going to catch up where states like New York are? And I think we just need to be very careful of that.
Do you think that part of this is that longstanding issue in Virginia of the kind of the differences between Northern Virginia and the rest of the state? So if you look at a map of where the outbreaks are in Virginia, it is mostly in Northern Virginia. I mean, which makes sense. That's where a large part of the population lives. That's where people live closer together. People in urban areas live closer together. So how do you convince somebody, say city officials in Danville, that you need to close your schools? I mean, I think, and I'm by no means have any medical or epidemiology knowledge, but everything you read is it will spread. I mean, it will eventually. So it's really the argument, I guess, is you should be ahead of the curve. But on an immediate basis, it may look like to people elsewhere in the state, well, we're not being affected. The closest case to us is in, Richmond or whatever. Is that part of the issue? Is there pushback from legislators in other parts of the state that don't want them to have a statewide?
I haven't, this is Barbara Favola. I haven't seen pushback from other lawmakers because, I mean, we do have access to a lot of information, and we believe it is our responsibility. I hope, for the most part, I would say every lawmaker believes it's his or her responsibility to take a leadership role in this crisis and inform, educate, and help our constituents. Is it, I guess your question is it such that people may be living outside of these areas that have experienced cases, do they take it seriously? I don't see how you cannot understand what's going on with the news feeds, that it's constant, it's 24/7. You turn on any channel, any radio channel, any TV channel, all social media outlets, they're all talking about it. So I believe people trust the governor to make the right decision. And I believe that right now, even in parts that haven't experienced large numbers, that there's this acknowledgement we need to do the right thing because it spreads. I mean, this is an infectious disease, and it does spread a lot faster than any normal flu. So that's why the governor was a statewide mandate to close the schools, which I thought was really important because you don't want school systems left to interpret guidelines differently.
Right.
That sends a very confusing message. So it was a statewide mandate to close the schools, and that was good. And this social distancing is going out consistently and constantly on all of the public news feeds that I think individuals would have access to. So it's an interesting point that Patrick brought up. I haven't ventured out of my Arlington base since I came back from Richmond. So I haven't seen other parts of Virginia. And I was surprised at Patrick's comment.
Mark, let me just I do think it's fair to say, Patrick made a glancing comment about the comments on Senator Chase's feed. I do think it's fair to say that there are still people, forget about in Virginia, in the country, sort of, let's just say, late to the realization. And I don't want to get into a big bash fest this morning. It's not our purpose of what's been happening at the federal level and how we've been a little late to realize things. But the good news is I think all of our leaders seem to be there finally. But it's certainly the case that all of our leaders weren't there for a while, and indeed all of our media wasn't there for a while. Mm-hmm. So it does, of course, always depend on what you happen to be watching or who you happen to be listening to. And I haven't been to Fredericksburg either, Patrick, but I have been certainly watching things online and such. I do think it is fair to say that there are some people still out there not yet convinced, put it that way, based on who they might have been listening to in the past. And so I think the three of us on this call, and frankly, all Virginians, all Americans, have an obligation to make sure that we're all making crystal clear exactly the scope of this problem so that everyone becomes convinced. And I think that's what the governor's been trying to do with his daily, and in a couple of days he's actually done twice daily news conferences and such. It's something we all have, as citizens, have an obligation to make sure our neighbors, our fellow Virginians, our fellow Americans all understand the scope of the problem we've got.
I think anyone who doubts that needs to just recall that 2 months ago, which was not a long time ago, this was only in China.
Yeah.
And now you've got 4,000 people dead in Italy. I mean, this thing moves, and it moves rapidly.
Well, it was actually only 2.5 weeks ago that we left Richmond. And I don't know about you two, but to me, it seems like 6 months ago that we left Richmond.
Yeah.
Yeah. No, I would agree.
And when we left Richmond, it was here, but it was not something that had yet gripped the nation from a media perspective. And in just those 2.5 weeks, obviously things have changed dramatically. Let me say one last thing, and I know you've got other questions you want to move to, Mark. with respect to the special session, I'm with my colleagues here. I don't think we need a special session. We do have upcoming what's called reconvene or the veto session, and I do think that gives the governor an opportunity to make changes and ask us for any authority he thinks he might need at this point, to particularly the budget, as we look at how this crisis might be affecting the budget we passed just earlier this month. So that's already set. There are some interesting questions about how we're going to conduct the reconvening. Putting 100 members of the House of Delegates and 40 members of the Senate in rooms, which will be contrary to law. But I know there's some smart people thinking about how we're going to be able to accomplish that.
It could be the first Zoom session of the Virginia. That's a long way from Williamsburg, isn't it, to Zoom?
Oh, dear.
But actually, you raised an issue that was actually my next question, Rip.